Okay. Yes. I was trying to honor the 10-minute guideline I was given. So these are actually two different notions. So bridge housing is 1 to 3 months of housing for adults exiting institutions. And after that 1 to 3 month period, they could, ideally, they'd be able to pay for their own housing. They could potentially reunify with a family member. Could be an adult with a spouse, with a parent, with an adult sibling. Could be a young adult child reunifying with his or her parents. There's a lot of scenarios there. And for those people out of the bridge housing who are not, where one of those other scenarios doesn't work, they could perhaps move into rapid rehousing and have a longer time with a housing subsidy. So that's that concept, and we are committing well over $10 million total out of our $100 million in one-time county funding for bridge housing. So that's that concept. The other strategy that you referred to is independent of that, and that relates to paying for permanent supportive housing. And the reality here is that local government is generally not well positioned to assume the cost of a lifetime housing subsidy or an open-ended ongoing housing subsidy. That's what the HUD vouchers are for, the Section 8 vouchers. So what I was describing is that in Los Angeles County, there are between 90 and 100,000 housing choice vouchers administered by 19 public housing authorities. The largest is the Housing Authority of the City of Los Angeles. Second largest is the Housing Authority of the County of Los Angeles, which includes the unincorporated areas and many small cities. And then there are 17 smaller cities that operate their own housing authorities. So our best opportunity to pay for that rental subsidy cost of permanent supportive housing for chronically homeless individuals, those are the people who have the greatest need, the greatest likelihood of needing a very long-term or lifetime housing subsidy, who are the least likely to be able to pay for their own cost of housing at any point. And that's a population that even if they, with SSI, where they could pay a substantial portion of their rent, they're going to need the ongoing services that wrap around that in order for them to live a decent life. So what our Board of Supervisors said was, we're going to take a portion of our federal housing vouchers that become available every year through routine turnover and dedicate those for permanent supportive housing for chronically homeless individuals. And that decision that our board made was to take 35% of the housing vouchers that become available through routine turnover in fiscal year 16-17 and dedicate them for permanent supportive housing. And then starting in fiscal year 17-18, 50% of those turnover vouchers in 17-18 and every year thereafter on an ongoing basis. That's our county policy decision. However, our Board of Supervisors only controls about a quarter of the housing choice vouchers in Los Angeles County. The remaining 3/4 are controlled by cities who have their own Section 8 vouchers, who administer their own public housing authorities. So what I indicated is that if you look back on the slide, you see that we have an overall shortage, if you look at the next to last slide, of about 15,000 permanent supportive housing units in Los Angeles County. We have about 4,000 vouchers that turn over every year. So if all of the housing authorities in Los Angeles County did what Los Angeles County is doing for the LA County Housing Authority, that would generate 2,000 rental subsidies for 2,000 new slots per year for permanent supportive housing. So in 5 years, that would generate 10,000 ongoing rental subsidies, federally funded rental subsidies for permanent supportive housing for chronically homeless individuals. And that would be about 2/3, that would fill about 2/3 of our current gap. So what I indicated in that regard in terms of the state's potential role is that in that case, we don't actually need state funding for the rental subsidies because the federal government will pay for those subsidies. But what we do need is help with the service costs, because even with the Affordable Care Act, and we'll see how the whole person care pilot and health homes play out, there is nonetheless a substantial portion of the required services, those that are not directly related medically, where at this point we're not able to claim Medi-Cal, and the state could incentivize localities around the state to do what our Board of Supervisors has chosen to do by providing state funding to help pay for the service costs that would wrap around those housing vouchers. So the federal government would be paying for the rent subsidy through the Housing Choice Voucher, and the state could contribute funding to help pay for the service costs. I hope that clarifies what I addressed previously.
Okay. Thank you, Chairman Nazarian. I wanted to pick up with some of your comments, Mr. Ansell, just now when you said that we don't need help from the state for rental subsidy.
Just for that specific population where they would be getting the federal housing subsidy.
I'm glad you clarified that.
That's right. No, we absolutely need, and that's what I indicated on rapid rehousing, on bridge housing, we very much, and disabled individuals pursuing SSI, we very much need help from the state, just for that specific category.
Well, you know, I don't know for sure, but I think a lot of people listen to these hearings even when they're not at them. And I think that this is a complex challenge where people think that cities and counties can do this by themselves. And it is impressive what the city of LA and Los Angeles County is doing. But, you know, I hear from many who just say, we just can't do it. And
that's right.
And I'm thinking about, you know, some of the cities that I represent, Berkeley and Oakland, and so many counties are just saying, we need help from the state. And I don't want anybody to walk away and think that this is a problem that's fixed, because I'm assuming that even given the significant investment being made in LA and Los Angeles County, it's still not enough.
That's absolutely the case.
Just want to get that on the record.
That is absolutely the case. And that's why I noted that we have an ongoing need for in over $300 million to address this problem. And what we have come up with county dollars is $100 million one time.
That was clear. Thank you.
Okay. So we definitely need help from the state.
Related to that, first of all, thank you all for your presentations. What I'm struck by is that we do have a deep network of great programs doing great things, yet we still have huge, huge challenges. And I could tell, Mr. Santana, from your presentation that all of this collaboration did not happen overnight. It didn't just start in the last couple of weeks because people were talking about it. That's probably taken a lot of time to really build that. And so I'm excited to hear the rich resources, but at the same time, concern, knowing that we have limited resources and that the state hasn't been able to be very helpful on these issues. I mean, I'm proud of, what we did last year in the housing support program, and I hope that we do more. But given the waiting list that you described, each of you pointed to how a housing first approach makes sense and helps lives and saves money. My question to you is really, how do we make it more than a slogan? How do we move to a framework of housing first? California has a very different funding mechanism than Utah and other states. And so how do we make an investment that has a real return on investment to make a difference for those lives while we're building the long-term strategies that you've talked about? I feel like we're gaining momentum because everyone's talking about it. And people are saying we live in high-cost areas and really all areas, not just high-cost areas. But how do we move to a framework of housing first in California, given where our systems are now? And how do we do it in a way where we make a real significant financial return on investment? We know that the return on investment socially will be huge. How do we make that financial return on investment given our limited resources?
I could take a stab at it, and others could join. So I really do think we do need capital funding because most of our communities, we do not have, even as Phil Ansell was talking about, even if all of the housing authorities in the county of California the county of Los Angeles put their turnover vouchers to create supportive housing, we'd still have a gap. We wouldn't fill the incomplete need. And we've seen in California that people are staying homeless longer. We have the highest rate of chronic homelessness in the country. About a third of all chronically homeless people live here in California. And the reason is because we don't have enough housing that's affordable to people in deep poverty. So there are more people coming into the homeless system as people are getting housed out of homelessness. There are more people becoming homeless. And I think Phil's PowerPoint about prevention is really true, that we need to shut the front door as well as the back door, open the back door. But I think that requires some capital investment to create more housing that's affordable to people, specifically in deep poverty. And that really would allow us to create more housing opportunities for support for those who need supportive housing. It would help us create more housing opportunities for people who are on the verge of homelessness and would fall into homelessness but for that housing. So I think that's one key piece. But I also think, as several of the speakers have mentioned, we need other strategies as well. Landlord incentives to get landlords to take housing vouchers. There are a number of housing authorities in the state of California who are not leasing all of the housing vouchers that they have because we don't have enough landlords willing to take them. It's difficult to rent somebody with a voucher. So trying to provide some grants to local communities to offer some incentives to landlords would be another way to create a pool of landlords willing to take vouchers. That would allow us to fully use those federal subsidies that right now a lot of them are being left on the table. I think also funding for services. We have been working to create a sustainable funding source through Medi-Cal for services in supportive housing. We haven't gotten there yet. So I think continuing those efforts, that would allow us to tap into federal funding, particularly since we have Medi-Cal expansion for those indigent adults who can access Medi-Cal now, could get funded. Those could be funded, services could be funded largely through federal funding. Again, we're not tapping into that funding sufficiently now, and I'm hoping that there are opportunities that lie ahead that allow us to do that. And then finally, I really do think we need some funding for rental subsidies. And that can be done through tracking data around our Medi-Cal savings. Medi-Cal saves a lot of money, and most of the money that it saves is at the state level and the federal level. If we can track, we don't know how much right now Medi-Cal is saving by moving people into supportive housing, but if we can find a way to track how much we are saving in Medi-Cal by moving people into supportive housing, and then use those savings to pay for ongoing rental subsidies, that would help us fill the gap that Phil and others have mentioned.
Thank you.
You're welcome.
If I could just piggyback on another area of investment, capital funding is, of course, critical. We need to increase the affordable housing stock in the state. On the streets of San Francisco now, despite our 6,000 units and despite placing over 11,000 homeless individuals in supportive housing since 2004, we have a crisis on our streets. We have more tents on our streets than I've ever seen. I live in Oakland. Oakland, I would argue, is the same way. And the individuals who are on the street now are older and they're sicker. We can't wait for capital investment. It takes a long time to build and acquire affordable housing. The strategy we employ in San Francisco, principally, although we do have a lot of capital investment in our housing bond, is a leasing strategy where we master lease entire buildings with a nonprofit intermediary, and those buildings are then, and the access is then controlled by us or by our nonprofit provider. This is something we can get off the ground immediately. The 1,320 units I talked about through our GA reappropriation, we brought those on in 7 months. We're at the stage, I know, I'm going to speak for my county that I work in and my county that I live in, that we need an immediate injection of resources beyond simply the county money we're using to do approaches like leasing or rental subsidies, because we can quickly move folks off the street into a model that works. I've been doing this since 2000, and finally we have unanimity on the right approach. Supportive housing is the right approach for those who are sickest on our streets. Rapid rehousing and rental subsidies is the right approach for those who have the means to increase their income. Now it's just about resources locally, federally, and now I'm very pleased that the legislature is showing that it has a role. The $142 million that my agency spends every year on homelessness, only about $2.5 million is state money.
If I could also add, in some ways it is a bit of a zero-sum game when it comes to Section 8. And, the city has a long tradition of committing 30% of our vouchers for exactly the purpose that was articulated. But for every voucher you commit to the homeless, and you're not making available for someone who needs affordable housing. So certainly there is a need for greater resources. But as echoing what the other panelist has said, one of the things that we're really exploring in the city is concepts around shared housing. Not thinking of housing under the traditional standpoint where individual units for individuals, but rather looking at it having a few people living together, sharing housing and responsibility. One of the other areas that I think is worth considering is looking at unification of families, particularly for the chronic as well as millennials. How do you link them back to their family members and create a supportive network around them, so that, and as well as the supportive services, both for the individual as well as for the family who's taking them back. And so because we know it's going to take time to build the housing that's necessary for the immediate term, I think, in places like Los Angeles, San Francisco, there has to be an infusion of these kinds of methods to address the immediate crisis.
Thank you. I appreciate you all. I know you weaved some of those statements in your presentations, but I appreciate you just really drilling down and being really specific about the capital development, the shared housing, the master leasing, and we're going to hear about that from an expert on the next panel. But just so that members hear that, there's so many things swirling around, and not everybody understands all the nuances of how these programs work. And I think to the degree that there's interest, I think the more that you help us shape what a specific strategy for immediate and future with long-term implications can be, I think is very helpful. Thank you very much.
Thank you very much.
Thank you.
We're thank this panel very much for your testimony. We're going to move into a focus on youth homelessness, and one of the panelists in the last panel talked about master leasing, and we're honored to have a panelist here today who is an expert on that. I'm going to brag on her a little bit because she is also a constituent who works in San Francisco but lives in my district. I'm not sure what the trend is, but I'm glad that it's going that way. And it's Amy Lemley, who is the policy director of the John Burton Foundation. The John Burton Foundation and Amy both are considered some of the most foremost experts on issues related to foster youth, to youth who are in transition. Among many things, Ms. Lemley founded an organization called First Place Fund for Youth. And to this day, it is the premier organization that helps young people transitioning out of foster care to find their first home. And there's master leasing. And that was a nice segue by Mr. Rohr to set you up, Ms. Lemley. And it is one of the most successful programs in the state and has now expanded to other parts of the nation to help our young adults who are in transition. So we're glad to have Amy Lemley here. We'll also hear from another panelist who will be introduced by Mr. Chu. But welcome, Amy Lemley, and we'll start with Ms. Lemley.
Thank you very much, members of the committee. My name is Amy Lemley, and I am the policy director at the John Burton Foundation in San Francisco. And I really appreciate the opportunity today to discuss the issue of homelessness among youth in foster care and juvenile probation systems in California. In 2010, California made a historic step forward in addressing homelessness among youth by extending foster care to age 21. Prior to the adoption of this policy, we know a full 65% of youth who aged out of the foster care system would become homeless in 1 year. So, based on the conversation of the previous panel, this is one example of excellent prevention where we can keep young people off the streets by better supporting them in their transition to young adulthood. So with extended foster care, these young people now have a place to live, the support of a social worker, and the supervision of the juvenile court. And as you can see from the first slide in your packet, the response to extended foster care has been overwhelming, with the number of older youth in foster care more than tripling since implementation. Prior to extended foster care, less than 3,000 young people age 18 to 21 were served. As of October 1st, 2015, we have almost 9,000 young people who would be on the streets, would be struggling, now that are benefiting from the rich continuum of services provided by our child welfare system. I think what's equally exciting is that the young people are using this time in a different way. We're not simply extending the runway as is often talked about. We've had a 42% increase in young people enrolled in community college in California in just 2 years. This is the kind of activity that is going to move young people out of poverty and into economic security and away from homelessness for the long term. So we're very excited about that. Now, while these signs are encouraging, it is important to note those areas where the child welfare and probation systems can do more to prevent and address youth homelessness. And in my remarks today, I'm going to focus on 5 areas. The first is the supervised independent living placement. Second, young people who run away from the foster care and juvenile probation systems. Third is improved access to child welfare services for homeless unaccompanied minors. Next, we'll talk briefly about the impact of unplanned pregnancy among foster youth and their likelihood of experiencing homelessness. And I'll close with a conversation about our state's THP Plus program, which does offer subsidized master leased rental housing for youth in their transition from foster care. But let's start first with the supervised independent living placement. And it is known in child welfare parlance as the SILP. So this is a new placement that was created with the extension of foster care. A SILP is different than a conventional foster care placement in that the foster youth actually selects the location and they receive the foster care payment directly. To be eligible to be placed in a SILP, a youth must pass a readiness assessment, and the housing unit must meet health and safety standards. Now, the SILP has been extremely popular among 18 to 21-year-olds in foster care in California, and as of October 1st, 2015, a full 41% of young adults 18 to 21, which we refer to as non-minor dependents, live in a SILP placement. Now, the issue of homelessness presents itself in a SILP when a young person cannot secure a SILP or when the youth loses his or her housing. Now, during these transitional periods, the foster youth can experience homelessness. Now, this is occurring currently in California despite the availability of funding to pay for a placement of the youth and federal law that gives non-minor dependents the same right to placement as minors. So this is very concerning and somewhat confusing. Now, why is this? And the truth is there's no single explanation for why this is occurring. One certain part of the answer is the lack of housing that can be rented for $859 a month. And that is the rate that is paid to non-minor dependents who are placed in a SILP. That's not a lot of money to cover all of your human needs, your housing, your food. And we're very fortunate in California to have a much more robust rate system than other states. But that amount of money, it's pretty hard to get out there and rent a place for that amount. Another possible explanation is a lack of understanding at the local level that non-minor dependents have the same right to placement as minors. There's often kind of a different set of understanding. It's like, well, they're older, but in reality, under California state law, they have the same right to placement. So whatever the explanation, and there needs to be more investigation here, we can all agree that it's unacceptable for foster youth who have an open dependency case and who want to be in foster care. These are not runaway youth. These are young people who want the visit from a social worker and court supervision for these young people to be homeless. And so what we do is we really do recommend a few different things, ways that the state can get involved today to help. One is the potential of augmenting the rate for young people living in very high-cost areas. $8.59 is simply not enough. A second strategy is to provide supplemental case management to these young people. They often don't know how to secure housing. They don't know everything that they need to do to maintain their housing. They do have a monthly visit from their county social worker, but can we augment that support in order to make that benefit go as far as it can? Another possible solution is landlord incentives for young people who are willing to lease to young people in foster care. Let's recognize and reward that behavior by offering them financial incentives. And until then, we would ask that the California Department of Social Services issue policy clarification that non-minor dependents have the same right to immediate placement as do minors. Now let's turn to the issue of youth who run away from the foster care and juvenile probation systems. The good news is in the last 10 years, the number of youth who are on runaway status at any given point has decreased significantly. Unfortunately, it's largely due to an overall reduction in the number of youth in these systems. And the rate over time has essentially remained the same. And you can see this rate on this slide. On average, as of October 1st, the dates below are actually incorrect. It was 2.9% of young people age 12 and over in our child welfare system are on runaway status. The rate is almost four times greater for young people in our juvenile probation system. That is a smaller system. Fewer young people are in out-of-home placement in our juvenile probation system, but the rate is much higher. That's why, if you might be wondering, why is the rate higher but the number smaller? It's because fewer young people are placed into that system. And so together, this equals 1,200 young people at that moment in time who are under the care and custody of the state of California, who are on runaway status and who are homeless. And as we heard from the previous panel, that's what is happening in a moment or time. You can probably multiply that by 3 to 4 to understand how many young people are experiencing a runaway episode during the year. Now, just to take a moment, I want us to really appreciate the profound effect that even a short runaway episode can have in the life of a young person from the foster care or juvenile probation systems. It puts them at extreme risk for a range of harms, including commercial sexual exploitation, other forms of criminalization, and certainly homelessness. There are numerous efforts underway here in California to serve these young people, including new state funding, which we appreciate very much, to serve commercially sexually exploited youth. And I believe really good work will come from that in the future years. And we support these efforts, but we also urge additional steps to draw these young people back into the foster care and juvenile probation systems. And what that really means is new strategies to partner with homeless youth providers around the state. That is often where runaway youth present themselves. We need to strengthen the relationships with those providers, and we need to be immediately ready to provide them with mental health and enhanced substance abuse treatment services. That connection between these two systems is largely absent at the local level. In some jurisdictions, it's very well coordinated, as you'll hear from my co-panelist, but in many others, it's not. And so we do call on the state to take more aggressive efforts to really find these young people so we can serve them and we can prevent their homelessness today and also change their trajectory as adults. The third issue that I'd like to speak about is about how to better use California's child welfare system to address homeless unaccompanied minors. Now, that might sound kind of crazy to some of you, because in the past, our child welfare system was regarded as the problem, not the solution. The common narrative was kids don't want to be in foster care. But thanks to the changes that California has made over the last 10 years, our foster care system is something that young people want to benefit from. We have new types of youth-friendly placements. We have ways for young people to receive the benefits directly. And we've created entirely new post-secondary education programs for foster youth. However, despite their interest, at times, homeless unaccompanied minors have challenges accessing the system. And there are a few different reasons for that. First, there is a very strong perception that unaccompanied homeless minors are not victims of maltreatment, but rather homeless because they're recalcitrant and would prefer to sleep on the streets rather than obey their parents. This is the image of the young person in the hate who wants to travel the route from Portland to San Francisco to Austin. That's a very romantic image we have of homeless youth. Unfortunately, and fortunately, the evidence about homeless youth counters that perception quite strongly. A 2010 study of homeless minors in Los Angeles found that 42 experienced physical abuse in the home before becoming homeless, and 17% experienced sexual abuse. Now, both of these forms of maltreatment would squarely bring them under the jurisdiction of Welfare and Institutions Code 300. A second factor that's preventing access to homeless unaccompanied minors to our child welfare system is really the absence of a process, an administrative process for young people to refer themselves. The current reporting system is designed to receive reports from adult professionals, such as teachers, physicians, and other adults who may call the child abuse hotline. It is not very youth-friendly, and it often results unintentionally of young people who report their maltreatment being screened out. So we recommend changes to this system so that homeless unaccompanied minors can have full access to foster care. A few ways that this can happen is shortening the timeline to petition to enter foster care under Welfare and Institutions Code 329, requiring an interview for children who initiate a petition, and creating systems to better support young people who proceed in this process. I'm sure, as we can all imagine, it's pretty intimidating being homeless, being a victim of violence, and then having to make your case that you were actually victimized. It's a process a lot of young people walk away from, even though they are legitimately victims and they deserve our protection. Now, these provisions and several others were included in the unsuccessful Assembly Bill 2001 from 2014, and we believe it would be wise to revisit these and others to use this wonderful, important system that is a federal entitlement that comes with 50% federal funding to address homelessness for those homeless unaccompanied minors that are indeed maltreated. The last thing I'll say about this is there's sometimes a reaction. We don't want to shoehorn homeless youth into foster care, which is absolutely the case. And for those young people who are not maltreated, who haven't been a victim of abuse and neglect, that system would be inappropriate. But right now, we know we have young people in shelter who are victimized, who have been subject to maltreatment, and we need to make sure we have an open process so that they can experience the support they need. A third area of concern that I would like to raise to the committee is the issue of unplanned pregnancy among youth in foster care and its effects on homelessness. Now, this is one of those, prevention with a capital P strategies that we can do today to prevent homelessness, not just among these young people, but even among their children. So in California, over a third of young women who are in foster care at age 18 will give birth by age 21. This carries with it a number of risk factors, most notably poverty and homelessness. And according to the Center for Disease Control, teen parents experience lower rates of high school completion, employment, and higher rates of poverty. All of these increase the likelihood of homelessness. Now, for the last 18 months, the John Burton Foundation has worked closely with 6 county child welfare agencies to pilot strategies to reduce unplanned pregnancy among youth in foster care. Chief among these is comprehensive reproductive health education for child welfare professionals, caregivers, and the youth themselves, along with the development of local policies and procedures to ensure social workers and probation officers are clear about their individual role in addressing reproductive health needs. This is something that, with the support of the state for additional investment in these kind of strategies, would be a cost-effective way of reducing the rate of unplanned pregnancy and really preventing homelessness. And the great news is, as a federal federal entitlement program, the training is matched 75% to 25%. So if we're looking for leverage, this is a great opportunity to bring that training into California. Our experience from working with the 6 counties is they're very excited about this practice and the difference it can make. They repeatedly share with us that the cases where dependents have a child or 2 or even 3 are by far their most complex ones, and that many of these young people do not want to become young parents, but they really don't have the intact family to have these kind of conversations with them to help them remain without a child. So the final factor I'd like to raise is the availability of supportive housing for youth after foster care. Now, our hope with extended foster care is young people are supported through age 21. They go on to college and career, and many are doing that. However, there are others who will need ongoing support, and specifically 2 groups of young people who have a serious physical or mental disability, or young people who are custodial parents. Now, to serve these young people, we urge a sustained public investment in the Transitional Housing Placement Program, known as THP+. The state legislature established this important program in 2001, and since then it has provided safe, affordable housing and supportive services to 25,000 otherwise homeless former foster youth. Since 2011, however, as you can see from this slide, the number of youth served by THP Plus has slowly declined from that peak of 1,550 in 2008-9 to most recently 1,257. Now, that's not a cliff, but it is a 19% reduction, and which we believe is due at least in part to 2011 realignment, which really created, we talk about flexibility as being a good thing, and it often is, but not when the flexibility allows you to divert money away from an important program like this and keep the funding. So we're very concerned about this. We don't see, there's no bigger booster of extended foster care probably than me, and yet even I don't think that this program is going to meet the needs for all youth transitioning out of foster care. We simply have too many young people with serious disabilities and young people who are custodial parents. And so we urge the legislature in this year to augment this investment so that we can ensure that all young people transitioning out of care have a safe, supported transition. A second strategy is to really slightly modify the eligibility criteria for this program. Currently, young people to participate have to be in foster care on their 18th birthday. However, we know some young people are exiting to guardianship or leaving through other means between age 16 and 18. We would propose that the eligibility criteria be moved back down to age 16. If you're still in foster care at age 16, you are at tremendous risk for homelessness. Nothing magical happens if you exit to guardianship or adopted at age 16. You're in a family for a relatively short period of time, and often those situations are not sustained after age 18. So this is a small change that could be made, which could make this program available to many more young people, but it would be important to add the extra financial support to ensure that those young people could benefit from the program as well. Now, if this trend does continue, California will lose an important tool in fighting homelessness among youth who age out of foster care. We don't want to return to the bad old days of 10 years ago when aging out of foster care essentially meant becoming homeless. We believe that we would like to see an increased oversight of THP+, and we'd like to see a deeper analysis of the effect of 2011 realignment on the program's ability to meet the needs of transitioning youth in foster care. There's a bit of a perception post-realignment this isn't the state's program anymore. It is the state's program. It's subject to the state's regulations. And we'd like to see a reimagination of the state's role for THP Plus in order to ensure that this program is sustained in the long term. Thank you very much for the opportunity to share my remarks.
Thank you. We're going to move into the next introduction and then take questions for both our panelists afterwards.